I'd like to bring up Assemblymember David Chiu, also co-author. Assemblymember.
Good morning. I want to thank Dr. Ed Hernandez, and I particularly want to thank the coalition that has represented all around us for moving forward this incredibly important issue. I've been asked, why am I a principal co-author of this bill? Some of you may know that one of the very first bills I ever introduced in the Assembly was AB 463. It was an early version of how we move forward the idea of drug price transparency. And what I said in 2015 before it died in the Assembly, and what I said in early 2016 before it died a second time in the Assembly, were many things that you know today. America not only has the highest drug prices in the world, but the prices of our drugs are many times what we have to pay in other countries. In fact, it is cheaper to fly California patients from our state to other countries to get them healed and bring them back than it is to actually serve them and have them healed in our state. We also know that drug price transparency works. Over the years, as we have tried to tackle healthcare costs with regards to physicians, we've used transparency and prices have gone down. We've done the same when it comes to hospitals, with insurers and health plans. This works. But one thing economists will tell you is there is one sector that has received protections as monopolists because of the patents that they receive. It is this area, and this is why, again, we need drug price transparency. Now, things have changed dramatically since my bill failed for the second time in early 2016. We had a pharma CEO, otherwise known as Pharma Bro, who was arrested and then convicted of fraud. We had 3 major presidential candidates who talked about the importance of addressing drug price transparency. Not just Bernie Sanders, not just Hillary Clinton, but one Donald Trump. And I'm not sure if anyone here thinks that Donald Trump is actually going to work on the issue of drug prices in Washington. I'm not holding my breath. I don't think any of us here in California are holding our breaths. We have to lead. Let me just close by sharing one story about why I decided to tackle this issue of drug prices. First couple weeks of my session, I was trying to decide whether to work on this issue that I knew was going to be a hard lift. And coincidentally, on a Sunday, I attended a church service at an African-American church in my district. And during the time of the service, when the minister asked, does anyone have any prayer requests? A woman stood up. She was probably in her 50s. She was dressed in her church best. She looked healthy, but she shared with the congregation that she was dying of hepatitis. And she had learned that there were drugs that could help her. Drugs that cost $1,000 a pill, $100,000 a treatment. And she did not have health insurance. She asked for our prayers. We have a moral obligation to address the situation. And that is why I'm here. That's why we're all here. We need to get this bill passed. Thank you very much.